Welcome to today's webinar where we talk about teeth and all the problems that we might have in our mouth. Now, before we get started, I would be really happy if you just very short tell me whether you can hear me, if my microphone is working this time, and whether you can see the picture. And I'll check here. I see all your messages here coming through. And yes, first one coming in. Lucky. You know, technical challenges with webinars are always a problem. And I put this here so that I can see your questions and can answer. We'll have in between a few breaks where you can ask your questions so that we can stay on track and actually stay on the subject. Now, teeth, big problem, especially when we talk about mercury. And I guess many of you are aware that mercury is toxic, but I don't think you are aware how toxic it actually is. When you look at the exposure that we have to mercury, it increased 20 times in the last 20 years. So it's quite phenomenal, especially baby boomers, you know, my generation, it increased drastically. And in our environment, we have now fish, end of the food chain, the big fish, the hunting fish, like tuna and marlin, with 1,000 times higher concentration than allowed by the health organization. So eating those canned tunas can be really lethal. And even though it's small quantities, it all builds up into our body. Mercury is the most toxic non-radioactive poison of all heavy metals. 10 times more toxic than lead, 4 times more toxic than arsenic, and 3 times more toxic than cadmium. And when you see what kind of effect it has on the blood, on hormones, on the brain, heart problems, stomach problems, you know, leaky gut very strongly related. Then we have reproductive organs, infertility as one of the main problems, in the bones. You know, it's like lead. It's an incredible ticking time bomb in your mouth. Now, there are 2 ways to deal with hazardous waste, and it is, when you look at all the descriptions, every product that has mercury in it is declared as hazardous waste. So it starts with your light bulbs. You know, if those spiral light bulbs break, highly dangerous. There's people who had to go directly to hospital who had a complete breakdown after breathing in those fumes. If you have any kind of vaccines that you have to throw away, you can see they have special instructions on how to use them as hazardous waste and how they need to be treated carefully and separately in special containers because they are so extremely toxic. Now, to fill them into a mouth of a child, into an adult, is actually a criminal act. And it is absolutely incredible that those large pharmaceutical companies can pull through such a massive poisoning. And you know, the evidence that they bring is so horrendously wrong. And even the evidence shows the problem, they still don't get away with murder in many cases. And that's a big problem. Now, when you look at the main pollution that we have, it's dental is the highest. Then you have vaccines as number 2. You know, very safe. Just do 22 shots for your freshborn baby. And then you have seafood. That's a lot less dangerous than having vaccines. Industrial and other point of pollutions. Now, the biggest problem that we have with mercury is a half-life of 20 to 30 years. So when you put it into a body, it's packed in fat. Your body stores it and packs it in fat to make least damage. And that means in your brain to a very high concentration. And for half-life to be half as dangerous as it is in the beginning, and we know it's 10 times more toxic than others, just to get 5 times more toxic, it takes 20 to 30 years. So it's certainly nothing that breaks down very easily and poisons the body. Now, this is probably the most shocking experience that I had when I realized how toxic mercury crowns are. And I'm going to play this video, and I hope the sound is not too loud in here, but this is a video that you will find on YouTube. I've only cut out a small portion to show you the fumes that are going away from a 25-year-old tooth. So it's not a new one, 25-year-old tooth, and you see the fumes. But let me just, before we go there and look at this, explain what they did. They had a test, they took a sheep and they put radio-labeled, like radioactive mercury into it, just to show how it can be scanned afterwards in your body. So they put that into a sheep, one at the bottom, one at the top, to see how it would dissolve. Now this is day 26. They took images 26 days consecutive, and it started out to be gray, and gray in your stomach and gray in your kidneys. Now the biggest problem here with kidneys, that's where your most chelating process in your body is. So they were instantly polluted. Day 26, the whole intestines, the liver and kidneys were completely poisoned, and the mouth. And they did that with monkeys as well. And you can see here kidneys, you see the ingestion, and it also went into the brain. And that's 26 days. Now think about, you have your amalgam fillings in for 20, 30, 40 years. Well, let me just play this video.
Substantial amounts of mercury constantly. The amount increases with any kind of stimulation, and as a result, mercury from fillings produces the majority of human exposure to mercury. The International Academy of Oral Medicine and Toxicology is extremely concerned about the anecdotal claims of safety by manufacturers and dental trade associations that are at variance with the published peer-reviewed scientific evidence to the contrary. The precautionary principle requires action once the possibility of harm exists. It does not require proof beyond a shadow of a doubt that in the case of heavy metal and xenobiotic exposure is both nearly impossible and unnecessary, in our opinion. What you're seeing is mercury vapor coming off a 25-year-old silver amalgam filling in an extracted tooth. The background is a phosphorescent screen. The mercury vapor absorbs the fluorescent light, and you can see it as a shadow on the screen.
I will put that video below onto our webinar replay page so that you can see it and watch it through. It is quite mind-boggling when you realize how toxic those teeth stay even if they are older. And we'll cover some more exposed problems as soon as you have different metals in your mouth. Now, when you look, and this is another fact that is proven, you know, like every poison that you have has certain lethal dose. If I give you that and that much gram of mercury, then that might be a lethal dose, or only 50% of the people die. That would be lethal dose 50. When you look, the approximately 2 to 3 grams of mercury are released with every person that is cremated. And they don't have filters with amalgam or mercury filter process. And that's why when you live downwind from a crematorium, it is highly dangerous, especially, you know, our age now, and people that are dying, they often have up to 2 to 3 grams of mercury. And 0.3 grams is a lethal dose, LD 100, for a grown human body, and 0.2 grams can kill a child. So just to put that in relation, what we expose all the time with 2 to 3 grams just by burning a person, you know, in a crematorium, a corpse, can already pollute our area so drastically. And then you have coal burning, coal mining, and you have all the other exposures that we have from our environment, from the pollution, all filtering into our food. And then you have your teeth on top. It is really scary. So don't live downwind from a funeral home. We're exposed to heavy metals from soil, you know, coal burning, everything. So very important. Now, when you look at your dental problems, you have 2 different metals in your mouth. You have, let's say, titanium, or you have gold crowns. Then you have here some mercury fillings in between. And then you have here maybe gold crowns. So gold is a much higher quality material. So it will corrode the low quality material beside it. And so many of you know, when you live close to the ocean, you have salt water, which you have in your mouth, and that is conducting, that carries electric energy. So you have a gold tooth, and then you have beside a filling with amalgam. And that will then create an electric galvanic reaction. It's like having a steel post and having stainless steel screws. The stainless steel will corrode the steel a lot faster. And that's a process that happens naturally in nature. And we have the same problem in the teeth. So if you have two different metals, there is a huge amount of mercury released, whereas a person who has only mercury fillings just has those fumes going off, but not in that excess intensity as if you have two metals. Now, another problem that we have is when we look at teeth, we normally think that when they are filled with mercury, that it's only in the tooth. Now, think about you have your teeth, they have a dentin. Dentin means it's a very soft, porous material with 1,000 little capillaries. And if they drill through the enamel shield of the tooth into that dentin, then put their mercury, amalgam, silver filling into it, and then that travels through those capillaries into your bone, down into your jawbone. And that's what you can see. This was an extraction, and they cut the jawbone afterwards to check from a corpse. And in here, where the extraction was, you can see the amalgam went down. And this is a very, very severe problem, because when you have exposed mercury, it starts to transform your bacteria that are in there into nanobacteria. Nanobacteria are those which you have in those living in those fine capillaries. So let's say you have a root canal filled tooth, or you have a tooth filled with amalgam. So it's a toxic poison that then fills all your tooth up inside and transforms normal bacteria into nanobacteria because of the pollution, the toxic pollution. And these nanobacteria transform and convert mercury into dimethylmercury. Dimethyl is an organic form of mercury, 10 times more toxic than normal mercury. And that is a process that happens over time. So if you have cavitations and there is a tooth in here which fills all the mercury into that cavitation down here, and the bacteria are enclosed, then those bacteria are transformed into nanobacteria. And those then convert your mercury into dimethylmercury. Now, when you want to know how toxic it is, there was a huge outcry in Germany when a scientist, Professor Karen Wetterhahn in America, died after exposure of 1 drop of dimethylmercury onto her latex gloved hand. So it went through the latex glove into her hand. So it was a tiny, minute portion. And she was aware of the drama and pulled off, and they scrubbed and they washed and they did everything to get it off. But it had already absorbed through the skin, through a latex glove, into her body. Now, after 3 months, she developed all the mercury symptoms, like hair loss, dizziness, fainting, falling over, concentration problems, everything. And after 6 months, she died with a complete degenerated brain. They did a biopsy afterwards because it was such a famous case with that dimethylmercury. And they realized the whole brain was eaten up, the whole body was destroyed, organs were destroyed. And even though they pulled in every mercury expert in the world to pull out toxins, they were way too late. Now that's 1 tiny drop through a gloved hand. Now think about, you have your mouth full and root canal filled teeth and cavitations in your mouth, and they all, work away and pollute your body. Now those of you who have mercury fillings, there is always that question, what do I do? Where do I go? How do I work with a dentist? And there are 2 different ways to measure how dangerous it actually is. Number 1, you would check which organ is related to the tooth that you have, which is filled with amalgam or is filled with root canal filling or has been extracted because it was infected or had an abscess. It's actually, I had to pull 2 teeth because they had eaten all the way down with mercury filling into my bone. So when I went to a conscious dentist, he drilled out the whole bone. There was a massive hole from here to there. Everything drilled out to get those mercury residues out of the bone. I had one of those cavitations here in my jaw, and there was 2 teeth that were filled with mercury, had leached down, and that all was filled with that gangrene, you know, with that cave. So when they pulled it out, it was actually those back jaw bones, which in my case, pancreas, stomach, thyroid, and breast, and I think it was at the lower side as well, lung, and my large intestine, my colon, which is always infected, always a problem. So you relate your problems to your teeth, and a very good conscious dentist will do that. They will say, look, if you have pancreatic cancer, colon cancer, breast cancer, and they look for the associated tooth and look whether there is a direct link. That is very important. You want to know if there is a link, and if it's related to your teeth, you need to clean that out. And yes, there is always that aesthetic and beauty problem. You know, I have no teeth up here, but I'm rebuilding the bone, and then I will have zirconia implants and then clean it up. So there are possibilities, but you need to bridge that time. But getting those toxins out is really crucial. Now, before, I wanted to show you now how they do it at the dentist, but let's look at something else. I mixed the slides up. This is really cool. When you think about how we all know mercury influences the brain, influences our way of thinking, causes balancing problems, you know, memory problems. You have all the diseases like Alzheimer, Parkinson's, all of them are related to toxicity in the brain. Plus, you have the other issue with brain fog, not being able to focus and concentrate. Now, when you look at this video, that will show you very clearly that this is a nerve cell. A nerve cell, they grow them in a petri dish and film that because it takes 2 or 3 days to grow them. Now, let me just explain you very short what happens when you build a new habit, when you learn something new. When you have your phone for the first time, what happens? It's quite overwhelming, and where do I press buttons and how do I do this? And after a while it becomes a routine, and after a while you don't think anymore and you do it naturally. This is a learning process. Now, for that learning process to be hardwired into your brain, you build constantly new nerve cells in your brain. And they then make that possible, that it's not stressful and overwhelming, it becomes normal. And with every growing nerve cell that connects synapses, all the energy through, it becomes a routine to you, a habit, something that you don't need to think about anymore. Now, when we use, and I just start this video,
live neuron isolated from snail brain tissue.
I should actually talk myself to it.
Growth cone activity. It is important to note that growth cones in all animal species, ranging from snails to humans, have identical structural and behavioral characteristics and use proteins of virtually identical composition. In this experiment, neurons also isolated from snail brain tissue were grown in culture for several days, after which very low concentrations of mercury were added to the culture medium for 20 minutes. Over the next 30 minutes, the neurite membrane underwent rapid degeneration, leaving behind the denuded neurofibrils seen here. In contrast, other heavy metals added at this same concentration, such as aluminum, lead, cadmium, and manganese, did not produce this effect. To understand how mercury causes this degeneration...
Again, I put that video underneath. Did you see that? It took that nerve cell 10 to 14 days to grow and to expand. And this is what we do. We learn new things and we make them our routine, and that's how our nerve cells in the brain and everywhere grow. And then they put 30 minutes mercury to it. Only 30 minutes, that short beam that you saw, and that causes within 30 minutes a complete degeneration. Now, you know, for me, when I realize the potency of danger that we have here, that we expose little children which are in the growth process, which just train the brain, and we expose them to heavy metals. When you look at the study of Ken Cook, the environmental health group, how many heavy metals a child inherits from the mother, and you see that they have up to, 260 or 270 toxins, of which there was 16 of the highest levels of cadmium, mercury, arsenic, lead, and silver in that toxic mix. you don't wonder why we have degeneration instead of acceleration in learning. Now, that brings me back to what I wanted to talk to before. That slide should have come first. This is actually how you can see it. Your tooth is filled inside with nerve system and blood supply, and it's seen as an organ. Now, if you have an organ like your appendix, for example, and the appendix is not working properly anymore, what would you do? You just tie it off with a string and leave it in there, or do you take it out? Well, a lot of people, they drill now out in here that pulp, fill that with toxic substance, and then they hope they can leave the tooth in because it's a lot more comfortable to have your teeth. But like I said before, this dentin, the yellow part here, are those fine capillaries, and they're filled with blood vessels, they're filled with nerve system. So when you take that out, but you still leave it in all those capillaries, that's where those bacteria grow. And those bacteria now get in touch with your mercury lesions, and then that leaches down into the root canal and into your tooth. And this is where we have that big problem that the mercury toxicity always gets into your body. Plus it fumes out at the surface, which you breathe in through your lungs. When you look at unconscious doctors, we always learn out of experience, right? And that was one of mine, which was probably the most shocking of all. I was quite clever at school. I was totally normal kid. And then my teeth, and this is something I want to talk to. I don't have a slide, but I won't forget. My mom wasn't caring for us brushing teeth. It was like brush your teeth, but she didn't enforce the habit. So as a child, you sneak out, you forget. Pretty normal, right? And because she didn't enforce it and she didn't drill it in, my teeth in the evening when I had eaten something, I went to bed and overnight it was starting to eat away. So I had a lot of amalgam fillings. My dentist wasn't conscious at all, so he just squeezed them in. I think he's as toxic and as polluted and as unhealthy as anyone else. Most dentists have actually a very high level of toxicity, so they are on the prime rate of toxic exposure. But he put it into my mouth, and some of them they didn't hold, and then they crumbled, and I spit out little pieces. And I remember my mum said, "That looks really horrible." Looks was more important than poison. So they were drilled out. And when they were drilled out, there was no awareness of sealing the mouth or protecting. And as soon as mercury gets hot, the vapor is tenfold. So I was breathing that in. And then all of a sudden, and I really remember, slightly, I was about 9 years old. So it's like my world had stopped. Couldn't focus, couldn't concentrate, couldn't read, couldn't learn, couldn't memorize, had balance problems, everything. And nobody knew where it came from. So my parents took me out of the school because it didn't work anymore. I couldn't even follow the class, and put me into a private school because you know what the neighbors would say. And that was kind of, put away into a more conscious environment. I went into a Rudolf Steiner school, and my teacher, the first thing said, when I look at his grades from previous years, he was phenomenal. And now he can't even follow what we say. And he then followed through and brought my parents to that awareness that I was poisoned by mercury. Started a massive chelation process. I had 5 or 6 or 7 chelation treatments. And I don't really remember when I was little, but it was something, I came out of a fog. I came out of a cloud. I came out of unconsciousness back into consciousness. And I can study, I can read, I can learn, I can do everything. So it has cleared up, and it was an ongoing process. I was using, I think, 20, 30 bottles of ACZ nano spray over the past few years as a constant tool that I have on every desk, in my car, in the glove box. I use that all the time. I have edible clay. I have all those things. We'll talk about those things. But it was an ongoing process. And to get it out of my brain is a very slow process. And that's why I'm so passionate about this subject. It's not because, it's just something you hear say. I was a victim. And I've seen people that heard from our movie that mercury fillings are toxic, And what did they do? They ran off to their, ignorant dentist who had no clue, drilled them out, and the next day their tumors exploded, doubled and tripled. They had no more concentration and their whole health deteriorated. So don't do that, right? You want a dentist who seals you completely off. They put masks on, they put breathing masks on, and then look, your mouth is exposed only for the tooth that is important. So it's like everything else is rubber lined, and then they work. And they have gas masks themselves. They have a big suction pump. They have done it now consciously, because I had a few hidden mercury leeches. Up here was the mercury filling, but it went through all the way and it was leaching into the root. So all of that had to be removed. Under a crown, I had still a crown over the top, and under the crown was still mercury. To get all of that out, you need a conscious dentist, someone who really knows what they do, and then protect you while you do it so that you're not exposed to more toxicity at that time. Especially when they drill out cavitations, at the bottom in your jawbone, there is toxicity levels that are so high they can knock you out. Do you remember what we talked about before? And I just go back very short so that you can see it. 0.3 grams are lethal. 100 LD1, lethal dose 100. So it's like 100% of people die with that dose. So you don't want to expose yourself with that just by going to an unconscious dentist. That's crucial. Now I have another shocker. This is where I really believe we are living in a very, very dangerous world. And if doctors come with their stupid technobabble and tell you, we don't know where your disease, you have a mysterious disease, we don't know where it comes from. Well, we actually do, because the lethal dose, you take 100 rats and 100 rats get an exposure so that one rat dies. And that's called lethal dose 1. 1 out of 100 die from that concentration. The others struggle, are unhealthy, but they don't die. Lethal dose 1 of mercury, and you add a lethal dose 1 of aluminium to it, you don't have lethal dose 2 rats dying, you have 100 rats dying. Lethal dose 1 mercury with lethal dose 1 aluminium makes lethal dose 100. They all die. Do you know that you have 1,000 times higher lead concentrations in your bone, in your brain, in your organs than you had 500 years ago? So when you think pollution isn't really that bad, every single time you put lipstick on or any cosmetic, it's filled with lead. If you buy toys for your children out of plastic, especially red plastic, it's full with lead. Paints, like so many sources. So we have lead exposure, plus we have mercury exposure. We must have dream immune system, dream detox pathways to survive that much, because we're all exposed to both. So don't underestimate the drama. And Dr. Mutter explained that really nice. I just had an interview with him and he said, the synergistic toxicity that we talk about is pretty simple. You put a cat overnight into a porcelain shop and maybe 1 cup falls down. That's lethal dose 1. Now you put a dog overnight, depending on the temperament of the dog, maybe from the wagging of the tail, 1 cup or vase falls down. Now you put cat and dog into the same porcelain shop overnight, you have lethal dose 100, they destroy everything. And that's pretty much what we need to be aware of. We have a lot of problems, synergistic problems. You have the neurotoxins, then you have endocrine disruptors, you have so many different things that play together, plus you have different cross-metal pollution that corrodes, silver, gold, and then amalgam, which means it corrodes the amalgam in half the time. And let me now come to a completely different subject, which brings that all together. Why do some people deal with it and have no problems? And then you have other people that struggle dramatically and have massive problems. The issue is pretty simple. You have people have inherited from their parents certain genetic activities. Now we do a nutrigenomic test, and that would allow us to see how different things work. How can you methylate, for example? How can you restructure your bones? How can you break down toxicity levels? How can you work out the bone density or deal with inflammation or whatever? You know, there's all different subjects that we study in a nutrigenomic test. And one of them is your ability to break down toxins. And that's what they use for pharmacogenomic testing. When you have any kind of pharmaceuticals, they need to prove to the FDA that these pharmaceuticals are broken down in phase 1 via this and this pathway, and in phase 2 via this and this pathway. Now we have here detox phase 1 and detox phase 2. When you break down toxins in detox phase 1, they become water soluble. They become actually more toxic, but that's how your body can deal with them. So your liver makes them, converts them, adds molecules to them, so they become water soluble and more lethal to your system. And then they're passed on to liver detox 2. That's where they are eliminated out of your body and then transported via the bile duct, you know, down into the small intestine. Now this is where we look in our charts, and red means it works less than 25%. Orange means it works about half, 50%, and green means it works more than 75%. This was a very good friend of mine. He brought this test home and we checked it, and it was like pretty obvious. Like, he couldn't deal with toxins, right? He couldn't break them down in phase 1, and he couldn't eliminate them out of the body in phase 2. Guess what? Over lifetime, you know, first inherited from the mother, and then over lifetime, every bit of toxin that he absorbed couldn't be eliminated out of his body. So it was all packed and stored away in fat tissue, and that was the main issue. So it was really a very dramatic chart. And when he had orally given chemotherapy by a doctor that snuck it in, he got so sick and he had side effects that were 10 times more dramatic. And this is what you can see. Patients who have very excessive reaction to chemotherapy, can't detoxify, die of the side effects of chemotherapy. They're usually the ones who have a good phase 1. You know, phase 1 makes it even more toxic, and then phase 2 is impaired. They can't get rid of the toxins. So before you do chemotherapy, before you vaccinate your children, before you do anything, test that. You know, why do some children go to school and have their vaccinations and they have no problem? And other children have vaccination, turn autistic, have seizures, have complete breakdown, collapse, brain degeneration within a very short time. It's because those pathways are not working properly. And pharmaceutical companies, when they prove, they say, look, they actually say everything is green, and now they take the drug to the FDA and say, look, it can be broken down by the liver, it's all okay. I haven't seen a single person who had all of this green. There's always impairments, so certain things cannot be broken down. And they talk about theory, and we talk about practice. And that's why it's such a crucial thing to know. So vaccination without this test prior is actually a risk, 50-50, saying I'm going to kill my child or I cause damage. And that's what we see more and more. All right? You see, I'm very passionate about this subject. When people ask me, how can I destroy a life of a child with mercury putting in their teeth? That's already, nerve degeneration and development problems, already dangerous. But then I add vaccines, and they are the two highest possible exposures that you can have. It really makes this whole thing impossible to survive today. Now, for those of you who are interested in our coaching program that we offer, we learn all of those things. You study from A to Z, all the different causes, all the different problems that can lead to disease and how to bypass them. So if you would like to know about those pathways, phase 1, CYP1A1, that's the pathways, what they do, what they break down, what kind of toxins, cigarette smoke, car exhaust, char, all of that. Then you have number 2, and then you have the B one. You learn that. So when you read a chart, you know where the impairments are, you know what influence they have on the body. And I believe this is really important because we need to understand how the body works before we suggest, before we give any advice. And that's why we've built all of those things into our program. Now to test is pretty simple. To start out with, you can do a simple hair mineral analysis test, and that will show you high mercury, high levels. There is a little bit of a handicap if you use shampoos, if you use some kind of dye and hair dye and all of that, bleach, then you won't get proper results. Pubic hair usually doesn't work as well, so you would need to cut your hair and cut then some of the fresh hair that is growing. That will give you best results and without any paint in your hair. So that's a bit of a handicap, but you can always do a chelation test. And chelation tests are the most accurate. We use the oligoscan, and the oligoscan measures accurately. And when you do a detox and you test again, you get results. So you can follow through. But we don't know how accurate the actual reading is compared to the others because it measures toxins in your tissue. So it's not the release of toxins, it's actually measuring the toxin in your tissue. And that can be criticized. I don't say it's wrong or right, but it gives us definitely an indication. We had a lot of people, and it was funny, I do this test at workshops normally, and when you have people come in that actually feel quite well, you see their levels are down. Usually caretakers that come in have a lot less toxicity, and then the patient has the test and values are very high. So we've observed that it has a value. It has a very accurate value, but I still prefer the challenging test for accuracy. You take either EDTA IV or oral EDTA, DMPS or DMSA, and that depends. There is different values depending on whether you have more exposure to mercury or more exposure to arsenic or fertilizers and all that stuff. So the doctor will find out. Then they prank you up with all the extra minerals because as soon as you do a chelation, you wash out all the good minerals too. So they refill the good minerals and wash out everything, including the toxins, and then refill your good material. So it's a little bit of a tricky thing. Plus, it's quite taxing to your kidneys. You need to flush the kidneys, do good liver support, all of that. But it's the most accurate of all. And you realize from the sheep, the first part that is exposed is your intestines and your kidneys. So flushing out through the kidneys and doing a chelation treatment is probably the best value of all. And we'll talk about different detox treatments. So oligoscan, hair mineral, and there is now a few new blood tests. Genova provides a very good blood test in full blood, not in serum, but in cells, red blood cells, which seems to be very accurate as well. So you'll find that. Find your practitioner, work out with them. It depends on your budget. They're not very expensive, but you want to know if that's a trigger for your disease. All right. Heavy metals are 3 things. I always, where can I put them? Which category do they belong? They belong to all 3. They're carcinogens, which means they cause cancer growth. They mutate your cells because of that exposure, not only degenerate and kill, they mutate your cells and turn them into cancer cells. So that's why when you see children being born, and I just was invited to a family, 3 children, and all 3 have brain tumor, sarcoma, lymph cancer, and when we checked the mother, very high exposure to heavy metal toxicity, and she passed that on to children. Now, you realize before that tiny little piece of mercury that they just dripped into that petri dish where the nerve cells grow. Now, think about those children have inherited in that early cell stage when all the cells divide, that mercury exposure. And all cells, while dividing, were mutated, were changed, were everything. And you wonder that then we have such an early stage of very, very aggressive cancers where very little works. Carcinogen. It's also a mutagen. Now, mutagens change this. So you might be born with quite well-functioning DNA, but then you pass toxins during your lifetime, and it's only an egg cell in a female that is at birth present. You have all your eggs that you use for all your menstruation cycles at birth. So as you go through and have, while growing up, exposure to all the different powders, all the, Johnson's baby powder, proven to be highly carcinogenic. It's like asbestos fiber. You have creams, you have petrochemicals, you have sun creams. All of that is absorbed into the body and can poison those eggs. And then you have different cosmetics and tampons and with chemicals in them and with fragrances. All of that. Then you have lubrication with petrochemicals. A whole range. And all of that builds up, and then you have a polluted, toxic egg. And then you have babies, and that's why we pass those toxins on to our children. And that's why the mutagenic effect, it's hereditary. You destroy the genes for all the next generations. Once they are destroyed, it's very difficult. You need good stock to come back, and then half is passed on to the children again. That's how they breed horses and cows and whatever, and find, the highest health value and strongest muscles and everything in putting that together. But if you get together with a person that is sick and degenerated, and you have all of those problems, the children will get that. And that's, again, hereditary problem. And then you have teratogens, which is usually the combination. Like we said before, we have lead and mercury, which is then a lethal dose. If you have teratogens, they are usually fertilizers with sprays and pesticides, herbicides, fungicides, and the mixed cocktail turns then into a teratogen, which causes malformation and organ dysfunction, organ destruction. Children that are born with, very tiny livers or very tiny little reproductive organs, all of that is a teratogen. Okay, now main causes for heavy metals. You can list every disease under the sun that you can find, whether it's autism, ADD, ADHD, ALS, infertility, chronic fatigue, depression, anxiety, Alzheimer, everything, every known disease in this world is triggered by heavy metal exposure. And doctors, I said before, call that idiopathic, whatever that means, dilated cardiomyopathy. We have heart palpitations. So you go to your doctor and they come up with their really clever words, and all it means, we have no clue. Unknown heart problems. And I found that quite shocking when you realize how they just put something into Latin to make you feel, oh, they are really special, but they have no clue where the problems come from. 100 hearts were found in patients with lethal heart attack. So they took patients that had a lethal heart attack and those who died of other causes, and compared the heart muscle content for heavy metals. 22,000 times higher concentration of mercury and lead. Do you need more proof? Dr. Rao had, when we made the interview many years ago now, 5 years ago, he said, Marcus, in the beginning when we had surgery of the prostate, for example, or breast, we took that into the laboratory. And when you cut out a small section of the prostate, you always cut a little bit wider so you get some healthy tissue and some cancerous tissue. And then we send that off to the laboratory to test. And we checked always both values, healthy tissue compared to toxic tissue, and not toxic, diseased tissue. And we check which concentration and what the main triggers are. Prostate, high concentrations of mercury, arsenic, and lead, and I think he said one other, I don't remember, but one of the heavy metals, and high bacteria exposure. Nanobacteria in the prostate combined with mercury we know is lethal. So just that alone should tell us that all we need to do is detoxify heavy metals. And it's not a process that you start today and you're finished next week. It's an ongoing process that will go throughout your life. First of all, you consume a lot, and secondary, you have a lot already that needs to be taken out of your body. Now, how do you do that? I put a few things together, and you'll find the slides below on the website just to give you a bit of support. We need to support the liver, right? We have 3 detox organs. Number 1 is the skin. Sweating. Number 2 are our kidneys. Chelation. We chelate out of our body. And then we have as a third one through the poo. And that goes detoxified in the liver, broken down, and then taken out of the body via stool. This is probably the most challenging detox pathway of all. Why? When you have toxins and you absorb toxins through the skin, through breathing, through everything, they go into the bloodstream and they go to the liver. Once they are in the liver, you have that issue of converting them in detox phase 1 to detox phase 2, and then they are eliminated through the bile duct into your small intestine. Right after the pancreas, right where you have the stomach outlet, that's where they are released into the body. Which means all of those toxins that your liver has converted travel through your whole small intestine, 12 meters, and then they go into the large intestine, into the colon, until they go out. This is the main tract where we absorb nutrients into our body. So while you have that transport through the body and absorption of nutrients, there is a lot of toxins reabsorbed. And that's why when you look at something like Gerson therapy, they eat a lot of fiber. Not only flushing it out through the juices and greens, they also eat a lot of fiber to have enough binders to hold on to that toxicity, heavy metals, so that they are eliminated out of the body. We also know that when we talk about the liver, we can have impaired metabolism, so not all livers work 100%. And that's why we need to support phase 1 or phase 2. Again, is that risky if you have a very weak phase 2? It cannot be taken out of the body. Your liver doesn't produce enough enzymes to break down in phase 2. But you activate phase 1. What happens? You remember, they are turned more toxic so that they become water soluble, and then phase 2 is not there, so they go cycle through the body and poison you even faster and more aggressively. That's why most people strengthen that process of phase 1, but don't encourage it to happen fast. Grapefruit juice in the morning, lemon juice in the morning would stop that process, slow it down. There are several medications how you slow down phase 1 and activate phase 2. And that's what you need to do. The whole B12, B6, folate, magnesium, zinc, iron, NCA, alpha lipoic acid, taurine, then glutathione, selenium, glutathione 2 times. So it must be important, glutathione, all the different vitamin B6, B3, B6, B2, B3, alpha lipoic acid, supplementation. It's not working without. You need to have a good supplementation, understanding to break down those toxins and to support your liver. I wouldn't do this without a nutritionist or without a naturopath that can really help you activate those 2 phases and do it well. If you find someone that is good, it's phenomenal. Like I said, we work with coaches and practitioners who can help you with that. Just go into the shopping cart, Truly Heal, and look under consultations, and you will find you can book a consultation. They'll work through with you the whole lot and help you find the best ways to detoxify and to deal with those 2 ways to support your liver. Liver, here we go. And I just made this too big. Let me just go down and change the size of this image. I made this too big to explain something. So go back. All right. Mercury is broken down in your liver Now that's the toxic effects of the liver, but chelation is broken down in your liver if you have enough zinc, selenium, modified alginate complex, modified citrus pectin, for example, zeolite, chlorella, cilantro, alpha-lipoic acid, and vitamin C. These are chelators. When you look at a heavy metal, they have a charge. They have an electric charge. Now they bind to your cells, and when they are free floating, they go back to the cell. So they always dock back onto a cell. So you want binders that can bind to those heavy metals, enclose them, and render them neutral so that you can detoxify them. And I'll show you some images to that. And these are those long chain binders that you want to have plenty in your system, in your body, in your blood, in your serum, so that when you start the detox process, then it's not like shaken loose and docks back on. It actually is eliminated from your system. Mineral antagonists, to actually flush out toxins out of your system, you need plenty of selenium, zinc, iron, and iodine. And copper-zinc imbalance, if you have too much copper and not enough zinc, with zinc deficiency promotes metal retention. So again, you need to understand when you do your test where the main problems are so that you can flush out toxins and don't retain them, and then sources where it comes from. Now, there is a lot of different ways to detoxify heavy metals. Number one, chlorella, vitamin C, really crucial. You know, they did a beautiful test, animal test, where they had mice, pregnant mice in both groups, and they exposed them to mercury, both of them, and then they treated one group with vitamin C to check out whether the babies were exposed to mercury. And the group of babies who had no mercury, who had vitamin C, had no mercury, while the group that was exposed to mercury and without vitamin C, the babies were full with mercury. So it's really important to understand that it's a binder, it's a chelator, and it can help you with flushing out toxins. When I spoke with some of the clinics in Germany, they said, Marcus, we don't really need to do a lot of detox for the body, because when we do IV infusion every day, plus we do hypothermia and heat treatment, we have pretty much all we need. A PMF to pulse it free, oxygen and to mobilize your immune system to activate that. And then we do hypothermia, which increases your blood flow dramatically. And then we add vitamin C as a binder, as a chelator, and then through that we can get it out. But it's a bit of a process. So vitamin C, very good. Spirulina, modified citrus pectin, activated charcoal, edible clay, EDTA, DMPS, and DMPA. Zeolite, like I said, the spray. I should actually get you mine and show you. And then we have iodine and cilantro and garlic. Garlic is a fantastic binder. It binds. When you go to Sanoviv in Mexico, what do? Every table in the restaurant has a glass of peeled garlic, and everybody eats raw garlic and chews that happily. They all stink the same, so it's cool, and nobody worries about it, but it's one of the best detox agents. We had for a time from Dr. Gordon that Hale, I think it is, those 2 high concentrated garlic concentrates, concentrate. So you can use that, and that is a massive detox agent for heavy metals. I spoke already about sauna treatment. Always, far infrared sauna doesn't need the liver to work. If your liver is impaired, you can't get it out the liver. You can only get it out through chelation, kidneys, and you can get it out through the skin. So start doing daily saunas. Get yourself a sweat box or a sauna dome and lay into it and start sweating and sweating and sweating, and it gradually reduces the load. The difference between a standard sauna, Finnish sauna, and far infrared sauna is pretty intense, because here you have the heat from the outside and you sweat to cool your body. So it's just, fluid that is extracted. In a far infrared sauna, you go with radio waves, with those waves of the light, you go into the body, you heat up blood vessels, then the blood starts to flow faster and warms up, heats that body from the inside. It's like a little fever reaction, and then you sweat from the inside. It's like a fever sweat compared to a cooling sweat. And that's why when you test the toxicity levels of sweat from a far infrared sauna to sweat from a Finnish sauna, the difference is factor 1 to 15. 15 times more toxins in far infrared. So that's really important. When you get yourself a far infrared sauna, it is probably the best way. Doing it daily, doing it as a meditation. I do it right now. You know, in summer we don't do it, but in winter time we sit every evening in and have our sweat, and it's fantastic. You can do enemas, you know, by water skiing on your butt, clay bath, IV treatments, and I said already, enemas. Again, let me explain. If you do one enema, one coffee enema per day, you go coffee into your colon, you flush toxins out of the liver. It's that reaction from the liver. It flushes out all the toxins into the bile duct. From there, they go and trickle in right after your stomach, right after your pancreas. And then they go through the whole body. So if you do not have plenty of fiber, plenty of binders, plenty of alginates and chlorella in your stomach lining, all of that is reabsorbed and just goes and makes you haywire. So doing that alone without the binders is again quite challenging or unwise to do. So have 2 or 3 enemas if you can per day, which means you flush out, you flush out, you flush out, and then go on top and have all of those binders to really make it possible for those things to bind together. What else do we have? Oil pulling, really great. You know what that is? Oil in your mouth, slosh it around. Clay bath, far infrared, hypothermia, IV infusions, exercise. You sweat through the skin and you pump, so it's really important. Chelation, then coffee enemas, colonics if you can. Colonics is quite comfy because you can do the gravity fit. It's not that strong flush. It's quite pleasant. And they sometimes do that too with coffee. PMF, very important. We'll talk about that in a moment. Zeolites, juicing, greens, liver flush. I'm not a fan of liver flush because if you have already a stressed liver and then you bombard it with a liver flush, for a lot of patients it's actually detrimental or worse. So I would be careful with that. And then homeopathics. Now let me explain very short the main danger that we have with heavy metals. Once you absorb them into your system, let's say breathing from your mouth through the lungs, they go through the bloodstream, and then they transcend into the extracellular fluid. Now the extracellular fluid is where you want to detoxify into, where then your binders can grab it and take it out. But you also have them dogging onto cells. They hold onto the cell. The cell, as we said, has receptor sites, different little receptors. And those receptors have, for example, the sodium channel, potassium channel, they have iodine channel, they have magnesium, zinc, selenium channel, nutrient channels. And if those channels, they fit perfectly to the molecule of mercury, for example. So when a cell dogs on, it actually blocks that receptor site. So your cell cannot take on nutrients through that receptor, and if there is plenty of little mercury particles, they block that. And then you have intracellular. When they go into the cell, that's when they cause total devastation, degeneration. They break the cell down, they break down the nuclei, they stop the cell from making ATP production. The DNA splitting, you know, within the cell, there is like a big factory where every DNA strand is replicated to multiply, for the cell to repair and to duplicate, and that is disturbed. So you get mutated cell, unhealthy cells, cancerous cells, and that's why it's such a dangerous thing. Now when we use PMF, and I'll show you both different ways. When you use PMF and you turn that on, and I'll just, hopefully my microphone doesn't die. I turn it on very short. It's a fan here, I hope it's not too loud. I turn it all the way down. Which way is down? Can't see. Okay, all the way down, because I don't want to start too high. And now I turn the device on and I bring it slowly up. Then you can hear in the microphone the ticking. And now I go up and I send magnetic pulses through my body. And you can hear duck, 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 duck. And it causes muscle tremors. So it's like a big magnetic push of ions. Dr. Rao calls it the ion shooter. Very funny word, but it shoots ions massively through our body and clears all of those cell membranes. So when you have a cell membrane, they actually clear out. And this clearing out means all the toxins are thrown out into the intracellular, what did I do? Okay, here. Sends all the toxins from the cell into the extracellular fluid. So it's like pushed out. And you can see that here in symbolic form. You put on and all your cells clear up and those little mercury or lead or arsenic levels are pushed into the intracellular fluid. Now you turn off. What happens? Ba-dung! Reattached. And some of them go through. So what do you want? You want binders. And I can only enforce that. You know, we always try to do shortcut and, oh, it's nice, it's pleasant. I just do that every evening and it's so beautiful, but you don't take your supplements with it, which means it's just shifting the problem from one location to another. You want to bind them. So taking binders, preparing your body, building up to it, and then having that treatment has traumatic effects. Dr. Gordon did a study. They had chelation patients that went through a chelation process. All their toxic levels were taken before they started. Now, one group was going through just chelation, just purely chelation. You know, he's the father of oral chelation, really a beautiful man. And the whole group went through purely chelation. And the other test group went through chelation and PMF. So they used PMF at the same time. The discharge, the toxic discharge, the end result was double. So they had discharged double or 3 times as many toxins than the other group. And this is where this has become probably the most important treatment of all. If you realize how dangerous toxicity is, heavy metal toxicity, and then you find a way to get it rid a lot faster. You put binders, whether that's DMPS, EDTA, or whether that's chlorella and all of those, the natural way, it still does the same job. So pushing them out into the extracellular fluid and then eliminating them with binders and then supporting your detox pathways, getting the stool out, flushing out, you know, not having it sitting for 3, 4, 5 days and then being all reabsorbed. You want that to leave the body as fast as you can. And that's why this is such an important. Those long chain amino acids are really crucial. So you can get them anywhere. And yeah, in regards to the 2 devices, because we get always the same questions, so I thought I'll explain them. It really is very simple. Here, every pulse that is sent out shakes loose on all the cells. Now, if I have a liver cell, it has a different frequency than a bone cell or a brain cell or an eye cell or whatever, heart cell. They all have different energy levels. So if I take this strong one and I pulse into my body, all cells at the same time discharge toxins. Very strong, even bones, because this is such a powerful bang that it rattles everything free. That's why you take them a lot less. You have this treatment here once a day, and you do that, a very short treatment, 15 minutes, you know, like you set the timer to 3 minutes, and then you do, first sit on it, you sit with your butt on it, and you give yourself an energy boost into the body, into your prostate, into your reproductive organs, into your colon, into your rectum, when you sit on it. Then you put it into your back, into your kidneys, which is a detox organ, where all the chelated toxins have to leave. You can do it quite gentle there because they don't need a lot of stress. So you do a gentle one in your kidneys. Then you put it around your leg, thyroid, lungs, heart, all your respiratory system, the thymus, all of that is activated to work, and you throw out all the toxins. And then you put it over your belly and full power, whatever you can, pump energy into your immune system, into your belly, and detoxify there. That's it. 4 times or 5 times if you want, between your shoulder blades, you can activate the lung area, but that's all. 5 times 3 minutes, that's 15 minutes per day, and even every second day, you have a full treatment. And that's why these strong devices are usually used in clinics where you have patients coming through and they come every second or every third day. Plenty of power to really achieve massive results. Now, if you don't have the money for such a strong device, you can get the small ringer, which I have no more. You know, mine are always selling too fast. But the little DCM 3500 is a pulsing device. It's not as powerful as those big ones, but strong enough to do a massive detox. So you feel the pulse in the same way. It pulses into your body, but not as massive. So you need to do a little bit more. And that's why the timing is set to 5 minutes. So you do 5 minutes on your back, 5 minutes sitting, 5 minutes around your neck, and 5 minutes or 10 minutes on your belly. And you have the same results as with this. It takes you half an hour. Now, for those of you who don't have the money to buy a ringer, you can still get those oscillating devices. And I have so much research. We have so many clients worldwide who love this little thing. Now, if I think it's plugged in. Let me just turn it on and I show you it's a different frequency. You can hear that little speaker. Now, this is the frequency, and compared to this where it goes bang, you hear this one going da 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 da. It's a vibration, and that runs for 3 minutes. Now, this vibration that we have right now will probably work on your red blood cells and some other cells in your body that are stimulated. Then 3 minutes later, the frequency changes and becomes different, and then it turns into a frequency that activates your white blood cells and your liver cells. So it frequencies, and it's like a tuning fork. You have one tuning fork you shake, and then the others start to swing along. Now, if I have here, let's say, a big tuning fork and here a small one, and I shake this one won't sing along. But if I have the same size, they sing. And this is why this treatment here needs always to go through the whole cycle. You need to have half an hour per area that you treat to have that result. So if you say, like I use this for bone regrowth because I really love it. It's very pleasantly warm. I just put that here, wrong side, this here because of my bone. And I just put that here and I pulse very gently into that area to regrow my bone, to stimulate my immune system in my jaw. And because it does my whole brain, my whole ear, everything, it stimulates that area to detoxify, to work. My immune system is activated. My oxygen uptake is great. I can take this and put that onto my liver and just have a liver treatment. You know, full on half an hour liver treatment. The program, as you can see, is 28 minutes. So it started, I think, at 30. And then it slowly goes down. And you can have, when you hold like a little speaker here, you can hear it. But you can also see how it works when you hold the magnet. You can see that. If I hold this magnet, how it moves. This is a strong magnetic field. And it's not dirty electricity. This is the earth magnetic field, like the vibration that your body needs to stay healthy and to work well. So using such a magnetic tool to shake all the toxins free in your body, you know, to do a detox for certain organs, for certain areas. And like I said, the brain is really pleasant. Same results. This one, you know, patient after patient, massive results, very short. Then you have the DCM, you do a little bit longer, still dramatic results. This one, same result, just takes longer. So don't worry, don't ever stress about money. Stress is worse than toxins. No, I don't think so. I believe that's not true, but it's close. So do not stress. Affordable and manageable. if you buy it with a friend, if you buy it with a family, these devices are absolutely crucial because your detox is so much faster than you can imagine. Plus, when you combine it with binders, the results are outstanding. We use this because, you know, it doesn't matter what disease you have. If you have Lyme disease, if you have chronic fatigue, if you have depression, if you have cancer, you can guarantee you have a high toxic level. You have very high levels of mercury, lead, arsenic, you have bacteria load, and all of that needs to be taken out of the body. You need to detoxify. Now, doing a detox on your belly with a pulsed magnetic field, with this one or this one, doesn't matter, will activate all your cells, will start the healing process, will stimulate your white blood cells, releases all the toxins. So it's like a mandatory treatment for all. And I just wanted to let you know, this device is for sale here in Australia. A friend brought it yesterday, so it's brand new and it's already in Australia, so you don't need to have any import cost or anything. If you want it, just give me a call. Go into trulyheal.com and there is contact or frequently asked questions. Fill out a support ticket, let me know, and you can have this device with a very good discount. And I wanted to let you know we have a mass order, which is a huge order for a clinic, and they ordered many devices. So we have bulk order. And I had that already 2 years ago, and it was phenomenal. So the PMT Digital, the digital device of this one, which is probably our strongest device that we have, is available for a discounted rate. Instead of 21, you get it for 16.9. That's phenomenal. So don't miss out this chance. If you want one of those power devices and you have a clinic, you have a fitness studio, you have a sports club, you have a wellness center, you have any kind of clinic where you have clients going through, or you buy it for a community, for cancer support group, all of that, you want a powerful device, and that you can do, you know, within a very short time, several patients, because they will have outstanding results. All right? And I think that's it. That's the PMT 120. Now, on the website further below, you can download our PMF ebook and earn yourself a 10% discount. Now, not on the discounted price that we have for those, but you can get yourself a 10% discount. And that's pretty simple. We've decided, instead of having reps, having demos, having explanations, telling every patient the same over and over again, we've created a training program. And you learn exactly how PMF works, why it works, what you do with it, which diseases are most or best treated with it, what combination treatments work best. And all of that is in our PMF expert training. So if you go to trulyheal.com, you will find at the top a PEMF expert training button, big button. And you click that, you get the ebook, you can download the ebook, you can go through those 5 training videos. And once you come to the last video and you've watched them, you get your discount coupon. And that coupon code will then give you a discount on all our devices. And that saves us repeating the same explanation and having sales teams and all of that. You can earn that money for yourself, all right? And that's it for today. Thanks very much for listening in. And if you have children, teach them right from the first moment on. Teach them to enforce brushing their teeth, caring for their teeth, cleaning up their mouth, and avoiding toxins from start, so they don't have the problems that we have to face today. See ya. Oh, I forgot questions. Oh my God. I'm so sorry. Webinar. I'm so into my world here. Where is my page gone now? Here it is. Okay. Marcus, can we pick up the machine? Yes, you can, if you're close to where we live. We are at the Sunshine Coast, Noosa in Queensland. And if you are interested in the machine, just go to the website, fill out the form. I have to take the first one that writes that form to give first chance. So if you want the device, just go trulyheal.com, contact, /contact. fill out the question, and I will call back in sequence. The first one who gets it, it's gone. It's only one device that we have here. We have the digital device, also one here. He brought me two, and the others are shipped. So you won't get around import duty here in Australia. For all other countries, that's not a problem. Do you also have a discount? I said the discount, sorry, do you have a discount for the DCM? No, it's not in Australia, like I say. I can't get them fast enough in. We have at the moment 5 days production time because we can't get them out fast enough. So for the DCM 3500, when you order, it takes about 4 or 5 days for them to be produced, and then it's shipped to you. The 10% discount is only available if you work through our PMF expert training, because that saves me explaining you again and again and answering support tickets and questions. I don't answer them anymore. I just send you the link to the PMF expert training because it's always the same. It's the same questions. Watch it carefully. Once you get in the end your code, then you can purchase the device. And for the for the digital, the 16.9, that's till the end of the month. We have that bulk order. So if you want one of those, you need to push and you need to get it through. If you get financing, we don't finance devices because we realize our financing is always 10 times more expensive than if you go through the bank. We provide you with an invoice, we provide you with a statement, and then you go to the bank and get your money probably for half the fees than anywhere else. Okay, next question. Okay, do I need to watch out with my binders? Can I take too many of them? Ew. How toxic are you? It's really, I always struggle with general advice. See, medicine, you can have no heavy metal toxicity, but you're full with virus and bacteria and have an overload. You can have asbestos toxicity. We have that tendency to use general advice. The best remedy is this and this. Rubbish. It's good for some who have that problem, but not for all. I really struggle with that concept of what should I take? How much selenium should I take? How deficient are you? Test. When you do tests, I know it's an additional fee that you have to pay. And let's say it's in total $500 or $800. I can guarantee you save that money manyfold in time, which you might hope and hope and hope and hope and hope and nothing works, right? Or you might save the money in massive amounts of fees. You buy this device and think, oh, it's going to save my life. And then you don't have heavy metal toxicity, like I just said. You have a viral infection or bacterial infection. And this is why medicine is such an inaccurate process if we sell treatments without knowing what the patient's problems is. Look, you can have a massive deficiency in zinc and selenium. Did you see how many processes your body needs to detoxify? How important all those nutritional factors are. If you have a bad gut biome, you have not the right bacteria, you don't absorb all those nutrients, so you lack, which means your immune system has no bullets, no guns to kill, or to detoxify or to take anything out of your system. Or you have such a high mercury pollution that your body has tried to detoxify and has used up all its storage of zinc and selenium, and your diet doesn't have enough. We need to find out what your particular problem is. So instead of saying, how much should I take? Is there a general rule? What is your particular issue? And I can only emphasize again, go to trulyheal.com shop. In the shop, you find on the right-hand side a category. I should actually show you if I can. Open up and go to, where is it? Here, trulyheal.com. See, I'm researching at the moment psychology and PMF, so massive research there. So you go into trulyheal.com, you open up shop, just a red button, and we're on a very slow internet here, so I hope it works. Let me just turn off Wi-Fi, because that goes through the same as you are watching now. And turn off airplane mode. So now we should be able to load the page. Okay, now here on the right-hand side under categories, you see we have consultations. And see, now we have no more internet. Turn on. Okay, maybe it's loading. Yeah, now it comes. So in that category, consultations, you find that here, and it's on sale for $850 at the moment. You will be working through a whole evaluation where we check every system. We look whether you're exposed to virus, to bacteria, to toxins, what your main problems are, what the symptoms are, which test you need. See, just say, oh, I need all tests. No, you might only need one or two. And then we recommend, and you can do always a very inexpensive test, or you can go for the luxury, Rolls Royce. That's your choice, but we recommend which are the most important areas for you to find out. And then we do a complete evaluation, which gives you complete clarity on what you need to do and which are the best treatments that will help you. This is $800 that I can guarantee you that are spent super wisely, because you save $800 just in supplements. And I can tell you, I have clients that come through the door that take everything under the sun and don't absorb anything because they just have one particular deficiency they haven't found. So don't go blind and do just what other people tell you. We need to find your particular problem to solve that issue. I know that was a long-winded answer. Sorry for that. But I think it's so important that we change with medicine back to common sense, to logical approach, instead of, oh, what are you doing? Let me try that too. Oh, it's only $6,000. And it's not important for you because you don't need that. True? All right, next question. Yeah, same thing. Do I need to take the supplements before I do PMF? Yes, you do, because you need to prime. This is not like taking zeolite and then having the treatment. Yes, with the spray it certainly helps, but that's sublingual for a short exposure. So you would need to build up, and not only zeolite, you would need to build up the whole time. If you have still mercury in your mouth, you need to have zeolite to bind all the fumes that are non-stop. Every chewing that you do will release some of those toxins. So you need to prepare and bind and do whatever you can at the same time. At the same time and prior to the treatment, so that you reduce the side effects. Okay, new question. Yes, is the level of toxicity to be measured accurately? With chelation test, it's quite accurate. Oligoscan doesn't give you any values, how toxic you are. They just tell you that you are off chart in comparison with 10,000 others. It's an empirical value, which can be quite okay, but we don't know. And with hair mineral analysis, it depends on how well you detoxify. So if you have high levels of mercury in your chart, that shows that your body throws out those toxins, but we don't know how much is still left. So again, hair mineral analysis is slightly dubious in its result, and oligoscan as well. Chelation is very accurate. I give you 8-EDTA or DMPS, and then 6 hours later we measure in your urine and we know how much your body throws out. And that gives us levels on how toxic you are. And it's pretty accurate, a lot more than all the others. So yes, you would need to do that with a professional doctor, chelation treatments, and you would need to prepare your kidneys and really do a good status of all your minerals before and vitamins so that you don't deplete through those tests too much. It's a bit taxing on your kidneys. Again, the DCM is not in Australia at the moment, but it will be shipped, and just contact me. We can arrange with shipping paper something that is not a problem. And this one here, okay, we have now 3 or 4 people writing. Can you reserve it? First come, first served. Just write in your name and email. and we'll get back to you. And if we have too many, we might be able to organize something. I have so many friends coming from America that might be able to bring one. Or in America, you don't have those problems at all. We'll ship it to you without any problems at all. Thank you for joining me for this dental experience and mercury toxicity, and I hope I haven't scared you too much. See you soon. Cool.